My name is Trish Neely, and I'm the Chief Compliance Officer for FBMC Benefit Management Incorporated. Today we're going to talk about the future mandates under healthcare reform. The reporting obligations for employers are very lengthy. I'll touch on a few of them. There are some notice provisions that employers must provide to their employees. They are spelled out throughout the volumes of the legislation, but what we are trying to do is to make that a more simplified process for employers by providing them with simplified lists of what those obligations are. Some of them kick in right away, some kick in as the reforms kick in. This is why I say that some employers may be able to talk their insurers into providing those notices. The W-2 reporting, and probably the most important thing to say up front, is that this is not a tax for employers, but what they must do is start to list on the W-2 form what the cost of the various premium coverages are. The IRS has made a sample form available on their website, www.irs.gov. And for any employer that wants to start using that form, they can do so in 2011. The requirement to begin reporting begins with year-end 2012, the W-2s that will be issued in January of 2013. For any private employer who is familiar with a summary plan description, this is not new to them. It will be new to public employers who were never bound by ERISA to produce a summary plan description. Oftentimes they're referred to as an SPD. The Uniform Benefit Summary, it's similar to a summary plan description in that within those 4 pages, 12-point type, you must include in there the basic plan details, who's eligible, who's not, what are some of the exclusions that are included, what are the costs of various coverages. Those are just some of the examples of things that are included. The reporting obligations apply to all employers. There's no minimum size employer or maximum size employer. It just applies to any employer and any plan that offers health care. FBMC can help an employer with their reporting obligations to know what those reporting obligations are, when those obligations kick in, and whether or not their insurer may also have a similar reporting obligation, and whether or not it's something that the employer may be able to get the insurer to do on their behalf. The mandates, and under healthcare reform there are 2. There's the individual mandate and there is the employer mandate. The individual mandate basically says that you must, whether you're sick or not, have health coverage, minimum essential health coverage. And if you do not have minimum essential health coverage, then you will be penalized. On the other hand, for the employer, they have a similar mandate. They must provide health coverage to all of their employees, minimum health coverage, or they have a penalty that they must pay. By saying minimum essential coverage, what reform is saying is that those restrictive Medigap coverages really are not going to be acceptable under reform. You can't just provide the minimum coverage in order to say that, well, I provide RX to my employees, therefore I have a health plan. There will come into existence, beginning in 2014, when those 2 mandates kick in, the state insurance exchanges. The entire purpose of the exchange is to provide a vehicle for health coverages to be made available to individuals. There are some individuals who are not employed, or who they may be employed but their employer may not provide health coverage at the workplace. And although an employer will be penalized for not providing health coverage, they can pay the penalty and an individual will then still have to go to the exchange to get their coverage. So the way the exchange will work is that various insurance companies will become certified to provide their product on the exchange. They will have standardized coverage. It'll all have to be the minimum essential coverage, and they must also have standardized rates. There must be a level of transparency like insurance companies have never felt before. Beginning in January of 2013, there's a new cap that will be placed on medical flexible spending arrangements, and it's a $2,500 cap. The $2,500 cap only applies to medical flexible spending arrangements. There's also out there several other what we refer to as tax-favored accounts. One is a health savings account and the other is a health reimbursement account. The $2,500 cap does not apply to those. However, the health savings account already has its own cap established. A health reimbursement arrangement is an employer-funded only account. Not as many employers offer a health reimbursement arrangement. A health savings account must be tied to a high deductible health plan, and many employers are offering those accounts now. There's nothing easy about healthcare reform, nothing. However, FBMC can play the role of a navigator for employers to help them through some of the changes that are coming up. For more information, contact us at fbmc.com.